So April, the blood pressure in the arm is 140/74. Central artery pressure means what's around the heart. There's a range for that too. She's on the upper end of that range. And the augmentation, the higher the augmentation, the stiffer the blood vessels. That's where it was, right? So yeah, blood pressure looks pretty high. So it wouldn't be a surprise that the central arterial pressure is a little high. And yeah, maybe the blood pressure vessel should be stiff. Okay, now this is what happened. This is April. And then this is May. May, it went from down to 125 to 111. That's the pressure around the heart. The pressure on the arm went from 140/70 to 125 normal. And the augmentation went from like upper end of normal 70 down to 11. So everything went down. So as I keep saying, hemoglobin A1C went down, inflammation went down, means the diabetes is better, and the blood pressure went down because blood pressure goes up because it's responding to inflammation. See what I'm trying to say?
Right.
Blood pressure is not called essential hypertension. We call it essential hypertension because we don't know what causes it. I know what causes it. Genetics is part of it, but genetics in combination with your environment, like eating too much salt, everybody knows, well, inflammation is one of the major drivers for high blood pressure, as well as other things like low magnesium can drive low potassium. So there's multiple, the blood pressure is a three-dimensional thing, therefore we shouldn't talk in two-dimensional language, like blood pressure is because of salt, blood pressure is because of genetics. It's multiple factors, and I'm just I'm bringing out inflammation because inflammation is not a two-dimensional thing. Inflammation can come from any number of places. We talked about adipose tissue, fat. Inflammation comes from microbes in the gut. Inflammation comes by signals from the brain by increasing your appetite and eating more. So it's a very complicated three-dimensional thing. So inflammation is three-dimensional, and so is blood pressure, so is diabetes. It's not like it's high, I'll give you a pill to lower it, because we didn't use a pill, we just use lifestyle, right? So let's explain that one. So I can show that one too, right? That was clear enough, yeah?
Mm-hmm. So what is she doing to make these changes?
We're doing it. Just kidding.
What are you doing to make these changes?
Yeah. So
Just curious.
yeah. So listen, why did her gut symptoms get better? We put her on a gut protocol.
Okay.
So I can go into detail, but gut protocol means I made the gut healthy.
Okay.
When you make the gut healthy, the microbes are healthy. The microbes don't send the inflammatory signal, so inflammation goes down. When the inflammation goes down, it doesn't disrupt the insulin receptor, so insulin sensitivity is high. So for the same amount of insulin, you have lower sugar levels.
Okay.
See? And so blood vessels, when we talk about blood pressure going up, is blood vessels are barometers, right? You have a barometer because if you touch something hot, you want to go away from it. It's a barometer, right? And your blood vessels are actually will give you a warning. It's a barometer that there's something in the environment and I'm responding to it because I see a need. And if you want to ignore it and just cover it up, that's fine, but you're not dealing with the cause of the problem, right? And so when you have a fire and there's smoke, you don't blow away the smoke and say, hey, fire's gone. Because the fire's still in there, right? You wouldn't be happy with that, right? And that's what we're doing when you have a fever, like with an infection. You say, I took away the fever, but I don't care about that abscess. It's not going to be very good, right? And in a less dramatic manner, much less dramatic manner, that's what happens with blood pressure. It's like, oh, it's just a little blood pressure. Don't worry about it. It'll be all right. And even I tell people, you're not going to get strict for 20 years. But do you want to let it go for 20 years? Because whilst you're accumulating risk for stroke, you're also getting the damage from either inflammation, oxidation, or immune dysregulation. And in her case, if you don't think rheumatoid arthritis is the definition of immune dysregulation, you need your head checked.
Right.
So by dealing with the gut and the immune system, I'm actually dealing with inflammation, which is dealing with her rheumatoid and her gut problems and the blood pressure and the blood sugar. It's like that's what talking about going to the root of the problem is. Now you can't answer it like that because you're going to fail, because you gotta compartmentalize it and talk about, and we'll do that as well. Maybe not now, but I'll tell you. We call it essential hypertension or malignant hypertension. Essential means that you're born with it, you got genetics for it, and it's just what you do when you're 40, 45, 50. You lose some weight, get some exercise to reduce your salt, but you know what? That's not going to help you. You're still going to get it. So do your best, but we're going to be on pill forever. Not so much malignant, we call it secondary. That means there's a reason for it. There's a tumor on the adrenal glands called Calm's disease. There's a coarctation of the aorta, so there's a it's very high blood pressure. You said malignant because very high blood pressure. It's not just a little blood pressure. Essentially, it's like little bit, little bit, little bit. You know, when you talk about secondary, which happens in much younger people, it's malignant because it's pretty high. Or renal artery stenosis. Those are some of the major cause of secondary. That means there's a reason for a build in the blood pressure. The essential just means we don't know what it is. I just told you we know what it is. It's inflammation, oxidation, immune, or at the very least understand that the blood vessels are barometers and the blood vessels are trying to respond to something. Go ask yourself, what is it responding to? And then if you don't find anything, so be it. But you know, we found everything and we treated everything and we fixed the rheumatoid, we fixed the blood sugar. When I say fixed, we've dramatically controlled it. We reduced the inflammation, which is not just for rheumatoid, global inflammation. And by the way, the blood pressure came down without any blood pressure pills.
Sure.
And yes, her diarrhea went away and she doesn't wake up at night to go to the bathroom. So it's great. So we can talk about her. So let's change position. And then